Dr. Lawani, let me ask you from your perspective what the network of collaboration looks like across these specialties as well as primary care. Is this something that as soon as we start to establish a good baseline for screening and exactly identifying those factors to refer to the next, I guess,
Sure.
informed caregiver, is that already well established?
So I think we're getting there. Obviously this was done in a non-retina setting. I think what will be very interesting in terms of technology, and particularly in a pandemic like we have right now, will be the introduction of artificial intelligence. If you can take screening photography and figure out what are high risk characteristics and have AI identify those, then you can know who needs to be watched in a different, more aggressive manner. So I think we're well on our way towards that. There's a lot to implement, and a lot goes with it. It's not just the technology; it's the resources to run that technology, to store the data, to analyze the data, and so forth. But I think we're well on our way towards achieving that in the next few years. Yeah.
And it kind of reminds me of a conversation we had just this morning with another ASRS presenter. I asked them essentially, how much has telemedicine been embraced or just, I guess, influenced in ophthalmology since obviously the pandemic began, and payer roles were
Sure.
a little bit more flexible to the
Yeah.
practice. And essentially, they said not much has changed, at least in terms of the regular day-to-day practice of patient screening, diagnosis, and care. But you're saying certainly, obviously, advances in AI has been robust. So is it something that it's a matter of application now, as you're saying?
So, I mean, part of it, to be honest, is equipment, right? For retina specifically, I think the majority of ophthalmology has heavily embraced telemedicine because the equipment is actually very simple as an iPhone or a Zoom call,
Yeah.
if you will. But to actually analyze the retina, you're talking about fundus photography and or home OCT, both of which are well on its way to being developed to be accessed, or and maybe not home OCT, or some sort of community photography or OCT perspective. And once you can figure out how to put that in place, maybe you put it in a Walmart where you have 100,000 people go through every day, and then you can access that images. I think the technology exists. It's now how to deliver it to the populations. That is the next challenge, and it is definitely a challenge, and trying to figure out how to get those patients to it and then to keep track of those patients and so forth. But I think that's very manageable. The technology, as we all know, it was the development of the iPhone first, and then getting it to the population happened easily. I think it's the same type of problem. It's a good problem to have. It's just trying to figure out how to make this work.